EGM Network.
Treasure Coast Connector. Connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Welcome to Treasure Coast Connector. I'm your host, Ellen Contreras. This episode is partially sponsored by Libby Weissman and her team at Senior Transition Navigators in Luxury Homes of the Treasure Coast. Libby works with seniors and their families, providing a nice assortment of services, helping them live their best lives in their senior years. I'm talking about downsizing, decluttering, packing, moving, relocation, estate sales, and more. For a free consultation, give Libby a call at 772-783-2800 or visit seniortransitionnavigator.com and luxuryhomesofthetreasurecoast.com. So as our loved ones get older and they need help at home, or if they're released from the hospital and they're in a fragile state where they need care, it's sometimes really hard to figure out what home health agency to choose, but not after today's episode. Joining me in the studio today is Pierre Beauge and Mireille Cherisol of Solux Health Solux Home Solutions. I was so nervous about your names that I messed up the company name, but Solux Home Solutions, Home Health Solutions, and they have so many interesting things about them that set them apart from everyone else that I can't wait for you to hear all about it. So welcome to the show.
Well,
Sorry about that, Pierre and Mireille. Okay,
Yes.
Solux Health Solutions.
Yes.
Oh, sorry about that.
That's okay. Well, thank you for having us.
Yes.
It is a pleasure. But first, I would like to thank God for this opportunity and for his continued grace over this business. My name is Mireille Cherisol, and I am a nurse practitioner with over a decade of experience in nursing. I've seen not all of it, but most of it.
Yes, a
So,
lot. And so I'm glad that you mentioned that, because this is a superpower that the two of you have. And Pierre, you are a registered nurse.
Correct.
So because of your vast health experience, firsthand health experience, this actually sets you apart from like pretty much every other home health agency in the area. And so that's, I think, very important for people to understand. Sometimes people start a business, they'll hire others, but you have been in the trenches with patients directly. So you know the good, the bad, and everything else. So that's how you move forward with your own agency so beautifully. So give us a little bit about your background also.
Yeah, thank you so much for having me. It's a pleasure. We said, we want to say thank you to the Lord first, because we have to acknowledge Him for giving us the opportunity. So yeah, my name is Pierre. I'm a registered nurse, over a decade of experience. So I've been in the hospital, nursing home. I work for other home health. I do travel nursing. So I've been at the bedside. I've hold the client's hands. I've going through, basically seeing them at the lowest level when they're going through those stages, they're not doing well. So yeah, home care is very important to us. It's something that we love. We have the passion, and it's basically we take the opportunity to serve our clients at that, in every level that,
Yeah. And then a lot of them, when they're able to reclaim their health once again, because not everyone that you meet is in a state of decline that continues. Some do into hospice,
Correct.
but not everybody does.
Right.
So that's a really great thing for you to also see the happy side as well afterwards.
Yes.
So I like that. So now Solux, Solux, for those that are listening on the podcast and the radio, that's an interesting name. So how did you decide?
It is very interesting. So I think the first name was Caring Hands Home Care. We realized that we couldn't own that name on Google. So we had to change.
There were other types of caring hands companies, so it was confusing.
And other home health, other like even daycare. So we couldn't get that name. So basically, we had to basically pivot, find another name. It's the same owners. We are, but we have to change the name. Solux basically, SOLUX. Sol is basically the sun, and Lux basically it's the light and also luxury. So basically, we come in. He picked that name as we meeting our client. We're providing that shining light. So we become that person that they need, they can trust, who can hold in their hands, going through that stage when they need somebody the most.
Yeah. And then of course with the word luxury though, it's also a way for people to understand that they're getting the very best care.
Correct.
And we're going to get into some of your other superpowers when it comes to that, but it's the quality of care that you are delivering feels like a luxury when these people come into their homes. So I love that very much. And now, and again, a lot of agencies, they will hire the medical people, but that is your background. So now we talked about why it's important for the patients that you have this background, but why is it important for like the hospitals that you're working with or the ILFs, ALF communities? Like why do you feel that that's a benefit for them that you have this background?
I think I can answer that. As a nurse for a few years at the bedside and then becoming a nurse practitioner, I think that give us the clinical expertise to care for those clients, to see both sides of the coin, because we have the ability to think ahead, try to prevent certain
problems from getting bigger.
Yes. And the biggest thing with healthcare is trying to prevent certain things. For example, falls at home, being able to be in that home and to assess the house for any fall precautions. That's something that could avoid a hospital stay.
Yeah.
So I think the clinical expertise definitely play a big role into the type of service that we provide, as well as the connection that we have to those case managers, even concierge doctors. We're able to relate and it facilitate the communication. Between the clients.
I like that a lot. I know you want to add to that, so please.
Yeah, if I may add. So yes, definitely. So when we come alongside the ALFs, the ILFs or the hospitals, so they want someone that a partner that they can trust. And we when they say they need a staff or they call us for a referral, they have to trust that we will come in. We will see that client. We will basically take care of that client, and we will provide that peace of mind. So that's basically what that's what we present. So we come in and basically, like we have patients in ALFs. We have patients, coming from the hospital. It's just that the case managers, what we do is the fact we are able to make their job a lot easier. A lot of times they want a private agency that will come in. The minute they call us, we there, and then we can take the clients to the home and basically set them for success. So that's basically what our partners are looking for. And we are basically very fast and reliable to do that.
Very good. And you're very good about building and maintaining relationships with all of these medical professionals and these other organizations, the case managers, the physical therapy, the like Encompass. I'm thinking of, I'm not a medical person, but like after someone comes out of the hospital, before they go home, they might go to a PT place for a little while.
Rehab.
Correct.
Yeah, rehab.
Rehabilitation. Yes.
Yeah.
Yes. So it is, I mean, to very short, it is, when you have a PT, the rehab centers who have the patient who wants to go home. And then we've seen it in the hospital. When the doctor say, Miss So-and-so, you're going to go home today. It's the best thing they want to, you don't want to go home.
Yeah.
So at the same time, they want a private, if they want a private care or a home care to come in. So they want somebody to be fast and to come in and get them home and get them settled and get the private, a caregiver and ready to go.
And the right care so that they can stay home. Not that a mistake has been made and then, oops, they're landed back into the hospital.
Yes.
And, you know a little bit about my story when my husband had open heart surgery. He's been on the show after, that. So, like, I'm not hiding it. Like, everybody knows it. But for the people that are listening and watching, that maybe health care is new to them because their parents are only just starting to get older, or a loved one or whatever, and then all of a sudden they find themselves in a situation where they're caring for someone like, I don't have any medical background, but my mom has to come home or my uncle has to come home, and they don't know what to do next. So what advice do you have for the average person like myself that has to talk to a case manager, and then the case manager says, so what agency, who do you want to work with? And then the person just goes blank. Mm-hmm. What questions should they be asking to select the right agency?
So as we, there's a lot of questions. So I think that what's important to ask when, case managers working on a discharge planning, get the patient home safely. So, a lot of things has to be, set, like, the medication has to be sent to the pharmacy and everything, right? Mm-hmm. That's important. So question that the family can ask, because we know it's very, very stressful when it comes to that time. Selecting a home care, and there are a lot of them out there, it can be overwhelming. So the question to ask, how fast I can have my caregiver, right? Mm-hmm. How do you screen them? Mm-hmm. How do you vet them, right? If they call out, how fast I can the replacement. Yeah. So if I call somebody, at any, if I have a question, how soon can I get somebody over the phone? So it's those are the questions. One of the questions that I've seen clients ask are days the caregivers. What do you background? Do you check the background? Background screen them, or is it So those are the questions that they ask. Mm-hmm. So that way they feel like they have someone mm-hmm. that they can basically at least trust.
Okay, well, wonderful. So Cindy gave me the high-tech sign that literally says, take a break right now. So we have so much more to talk about that I want you to stay tuned. We'll be right back. Sorry, I messed up in the beginning. And I always say...
Hey, you! Host your very own show every week at Evergreen Media Network in Vero Beach. Go live to YouTube and Facebook with up to 4 people and your very own producer. Be heard on more than 15 podcast platforms and local radio. All you have to do is show up and talk. Your guests can join from anywhere in the world. It's easy to get started with the largest podcast studio on the Treasure Coast. Contact Evergreen Media to tour the studio.
Create your restful retreat and save 50% now on all Tommy Bahama and Lexington furniture during the Home for the Holidays event at Sunshine Furniture. Sophisticated looks with a mix of coastal and Caribbean styles, Tommy Bahama offers everything you need for your personal paradise and is all half price. At Sunshine Furniture, we have the largest selection of in-stock coastal and casual sofas, love seats, chairs, slipcover sofas, bedroom dining, and occasional furniture from Four Seasons, Capri, Best Chair, Hooker, and Riverside. We're the outdoor furniture experts and have any style of patio furniture that you need, including a gallery of Made in America, Berlin Garden, Pollywood, Woodard, Lloyd Flanders, and Telescope. We specialize in replacement cushions, umbrellas, and fire pits. Come in now for our Home for the Holidays event and winter sale. Don't forget to visit our outlet and sales center directly across the street, Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Visit our website at sunshinefurniturecasual.com.
At Evergreen Media, we know the people, the businesses, and the work needed to take your marketing to the next level. We know where locals go to shop, work, and have fun.
We're here to focus on your local advertising so you can focus on your business. This is our home. This is our business. Evergreen Media. We market, you grow.
Welcome back to Treasure Coast Connector. I'm your host, Ellen Contreras, and I'm with Pierre Beauge and Mireille Cherisol of Solux Health Solutions. Okay, I got that right. And I always hate mispronouncing names. I always feel bad about that. So now in the first half, we spoke about the fact that, you know, you're a nurse practitioner, you're a registered nurse, and why you started the company. So it's clear that you have the skills as well as the passion. So, and you also believe in a high level of customer service. So that's really great. But what I'd like now to talk about is the list of services that you offer, the coverage area, that sort of thing. So if you want to start off.
Yes. So we are a home care agency, and we recently got our nurse registry license. So which means we can provide home care services, but with the registry, we can provide skill services, meaning if you need RN services, like a nurse to come in, let's say to do dressing change, medication management, we can provide those services as well.
Great.
We did start as the home care, where we were mainly private duties, focusing on medication reminders, light housekeeping, companionship, mobility assistance. But now with the registry, we could do a little bit more.
So you have all of that helping people, you know, getting in and out of bed and dressing them and things like that. But then that step further of actually giving them their medication and changing dressings and things like that.
Correct.
Yeah. Yeah. I remember my mom had an operation and she needed a wound vac. So is that something else that you would do also if needed?
If needed, we can, with the help of the nurse registry, because we can hire nurses to take care of that wound vac.
So now it's a full suite of home health services. So I like that. And what about the coverage area? How far north do you go? How far south do you go?
So we cover the Treasure Coast and the whole Treasure Coast. So basically, Area 9 or 5 counties. Indian River, St. Lucie, Martin, Okeechobee, and Palm Beach.
Oh, wow.
So, yeah,
Huge
we have
area.
clients all the way in Delray. We go all the way down there to see clients. So, we basically, you know, I think I remember one day I would travel from Delray to Sebastian.
Oh, wow.
And so multiple times. So in my car, it has so many mileage on it. But you know,
so
it's
maybe
just
a corporate helicopter down the road. It could be. You never know. We'll put that on the back burner for now. And then what about your contact information? The phone number, your website.
Yeah. So if somebody wants to apply, or our phone number is 772-924-4431. Or they can also call or text 772-306-0233.
Now on your website there is another number, the 772-475-0900.
0900.
Okay,
yes,
so that's okay too.
That's okay too.
Okay,
and
very
our website is www.soluxhealth.com.
Yeah, and it's SOLUX health.com, and then the email is care@Solux Health.
Yes.
Okay, very good.
Yeah.
So for people like myself, or for, you know, the people in the medical community that need to send one of their patients to you. And then of course, we're gonna talk about the staffing aspect in a moment, as far as it relates to the hospitals and other places. But before that, you have a career page on your website. So if somebody is a CNA or a nurse, they can actually go to soluxhealth.com and look and see what's available, or even just apply, right?
Yes, they can apply, and we're always accepting applications. We're always recruiting. They can go to on the career page and then send us their information, and we get on that really fast, and we get our care coordinator and our HR department get them screened and everything.
Yeah. The other thing I want to mention before we get into staffing, and I'm smiling because my mother, when she needed help during her cancer battle, she was scared, and sometimes she wasn't very friendly. Sometimes she was a little difficult, right?
Right.
So what I liked about how you were describing how you work is you get to know the people that work for you and their personalities and even how they like to communicate.
Right.
And you actually match their style with the style of the patient. Or if somebody is a scared type A like my mom, you would know which person to send that would have a better chance of calming her down.
Yes. So I can add a little bit to that. I think it's very important to know the caregivers and the client that you are serving, because that can make a difference in the type of care that they will receive. And I think it's one thing that we do when we meet with the client is ask them, tell us a little bit about you, your personality, so that can help us to better match with the caregiver. Yeah. And another thing is we do see a lot of patients with dementia, and sometimes they're afraid to just, get close to somebody. And sometimes we have to start slow and slowly build that rapport to increase the chance of the success for that care.
Very true.
So that's something that we do.
Yeah. If I can add to that, is this our caregivers, when we out there doing assessments, seeing the client and see what kind of need they have. So we collect that data, and then we basically, as you said, as we talking to the family members, we ask them those questions. So in the back of because we know our caregivers, we already know, okay, this is the person that we think that will match, right? Sometimes the patient and the family member will say, well, we want somebody who's, this, a little quiet, stuff like that. Or once they say they want somebody a bit quiet, somebody who can, we will know exactly who to send them. Yeah. Because that will basically, we're very happy with our first time we match a caregiver to a client. We above 95% because we always get that.
That's nice. Yeah. So 95% of the time, the person doesn't have to be swapped out.
Correct.
I like that very, very much, just because my mom threw out a couple of people out of the house. I'm sorry. She's up there now, so I can say it. I'm in a lot of trouble when it's my turn to go up there. Oh, she's going to be so mad I called her out. But another thing, we have literally like a minute left. So we hear about nursing shortages at times or other types of shortages. That's another superpower. You are also a staffing agency.
Yes, we are. Very quickly. Yes, we do provide staffing to hospitals, nursing home, rehabs, and their doctor's offices. We hire PT, OT, RN, LPNs, MA. Yes, we basically, because we in the hospital, so we know exactly there's a shortage.
Very good. So soluxhealth.com is the website, and it's care@soluxhealth.com. And then that other number you gave, if you want to repeat that number.
Yes, 772-924-4431. Or they can, sometimes people want to text, they can also call or text 772-306-0233.
All right, that's perfect. So what I want to do very quickly before I sign off is also say, and I'm going to talk to you about Libby also, seniortransitionnavigator.com, luxuryhomesofthetreasurecoast.com. Libby is a senior herself. She loves working with other seniors to figure out the next steps in their lives. And her number, 772-783-2800. And you can visit seniortransitionnavigator.com, luxuryhomesofthetreasurecoast.com, and look at a whole suite of services there. And with a few seconds, I just want to say thank you very much to both of you for being on the show. I'm a big fan because I was in staffing and recruiting, and I've been on the other side caring for mom and husband, and you've made a world of difference to a lot of the people that are listening and watching. And with that, my name is Ellen Contreras, host of Treasure Coast Connector. Until next week, I miss you already.